So Navadita, back again. How are you today?
I'm very well, thank you.
All
How are
good?
you? Yes.
All
yes.
well, thank you. So what are we supposed to be discussing today?
So there are a lot of women coming to the clinic, and the first confusion that they have is, what is menopause?
Okay.
So
to clinically define menopause, it means that a lady should not have had periods for at least 12 months. So the last time she had her period, till let's say whenever she sees you, it should have been 12 months and more. That is defined as menopause clinically.
right, and they ask us that, okay, we had spotting or some brownish discharge, say for example after 4 or 5 years of menopause. So do you think they should ignore it, or they should report to the hospital? How to go forward with that?
So any bleeding, whether it's brown or red, after the menopause, as defined by 12 months of not having a period, should be investigated by a doctor. That means, to answer your question, that you should visit a doctor if you've had any postmenopausal bleeding. Now, why is this important? This is important because postmenopausal bleeding can be a sign of cancer. It's not always cancer, but that is the first thing that needs to be ruled out. So yes, it is very important to see a doctor if there is any postmenopausal bleeding.
Right. So coming to again the next question, that what are the different causes of bleeding after menopause?
We'll talk about the most important cause, and that's cancer, but that's not the most common cause of postmenopausal bleeding. So the first thing we would like to do is rule out cancer, and this cancer could arise either from the mouth of the uterus, which is the cervix, or the uterus itself, or locally, which is quite rare, from what we call the vulva or the vagina. The other causes of postmenopausal bleeding could be any local lesions on the outside. It could also arise from the urinary area or from the motion area. So this needs to be looked into and sorted out.
Yeah. And when they come to the hospital with that complaint, how do you manage these patients?
So basically, obviously, we take a full history. We also try and find out if they're on any blood thinning agents. Have they been on any chemotherapy, especially for breast cancer, which can sometimes cause thickening of the lining of the womb and cause bleeding? We examine them. We do a thorough examination, look for any local causes, do pap smears. We then ask for a scan to look at the uterus, the ovaries. And then, depending on what we see, we then plan further management.
Right. So the final message would be from your side?
Final message would be any postmenopausal bleeding after 12 months from the last period needs to be investigated, needs to be seen by a doctor. It is not always cancer, but it has to be ruled out. And remember, when cancer is picked up early, it is very amenable to treatment and therefore a cure. So see a doctor if at all there is yourself or a family member who has postmenopausal bleeding.
Sure.
Yeah.